Hi, I'm Dr. Garvey Rene, and I'm an interventional cardiologist with CareMount Medical. February is Heart Health Month, and we have 5 heart healthy tips for you. Tip number 1, know your numbers. Know what your blood pressure is, know what your cholesterol level is, and know what your hemoglobin A1C is. A hemoglobin A1C is a routine blood test your doctor can do to check yourself for diabetes. According to the new guidelines, hypertension now starts at 130/80. However, an ideal blood pressure should be 120/80. It's something that we should all aim for. In regards to your cholesterol level, there are 3 components that you should be very aware of when it comes to cholesterol. Your LDL is technically known as the bad cholesterol and has been shown to be the strongest related with a history of heart attack and stroke. An ideal LDL level should be less than 100. Your HDL is your good cholesterol level. A higher HDL level, usually above 50, is considered to be protective when it comes to heart disease. Your triglycerides are another fats, also another part of the bad cholesterol, that's also been related to heart disease and stroke as well. When we consider all of them together, a total cholesterol level of less than 200 is desirable. Number 2, know your family history. It is very important for you to have an idea what your family history is, particularly if there's a history of early heart attacks in one or multiple family members, or if the history of life-threatening arrhythmias, or if you have a history of clotting disorders. Number 3, it is absolutely important for you to find some time to exercise. And by exercises, we don't mean that you need to be running a marathon, you don't need a triathlon, but you need to do at least 30 to 45 minutes of cardiovascular exercise at least 3 times a week. So you want to be sweating, you want to be increasing your heart rate. So whether that involves you dancing, whether that involves you playing tennis, whether that involves some running or some kind of activity, you want to increase your heart rate and you want to start getting moving. Also, it's fine at least a couple times a week, see if you can do some resistance training. The resistance training can involve anything from yoga to some light weightlifting. You want to incorporate that and alternate that with cardiovascular exercise as well. Number 4, it is important for you to find time to reduce your stress. We know that stress can have a lot of adverse effects in our body. Not only stresses our cortisol level, but it can also raise our blood pressure. It pushes us into adopting some unhealthy habits such as sleeping poorly or eating poorly or even smoking. By reducing stress, you can significantly reduce your chance of developing heart disease. Number 5, it's very important for you to learn to recognize the signs of heart disease. If you're experiencing chest pain, or if you're experiencing shortness of breath, or chest discomfort, or through exercise, or whether it's at rest, or if these symptoms are somewhat new and you never had them before, it is important for you to consult with your doctor about these. We use these 5 tips to maintain a healthy heart, not just through February, which is Heart Health Month, but for the rest of the year. From prevention to intervention, we're here to help you lead a healthy and active lifestyle so that you can enjoy doing the things that you do and spend time with the people that you love.
Healthcare that revolves around you. CareMount Medical.